So, hello everyone. Ever felt why your voice isn't being heard or your conversation is being disrupted? So, welcome to today's session of Psych Talks 2.0, where we believe in listening, learning, and empowering. I'm your host today, Dr. Shahin Sulthana here, and today our special guest is with us dealing with communication issues. Today's episode is all about communication puzzle, where we'll be unpacking speech and language delay and find solutions for all the issues which are being presented. With this, let me introduce you to today's guest. She is a speech language pathologist working in Sri Ramachandra Institute of Higher Education and Research in Chennai. She is having a vast experience of 5 years working with children and adults along with communication and swallowing difficulties. So we warmly welcome you, ma'am, Ms. Shahin Sulthana.
Thank you, ma'am. Thank you so much for your kind introduction.
Thank you for accepting the invitation.
So it's a pleasure to be here. I think we're doing it for the second time, and I'm glad I'm here.
We are really excited to have you for the second time, ma'am. So I have a lot of questions, and I guess viewers here again will be having a lot of questions arising regarding speech language pathology. So the first question being, what is the role of a speech language pathologist, and how different it is to consult you, and what difference it makes when we consult a normal ENT doctor?
Yeah. So a speech language pathologist is a profession who assesses and treated people with difficulty in communicating and swallowing. And we also deal with patients who have difficulty in speaking clearly, fluently, and voice problems as well. So, when compared to ENT doctors usually focus on the medical and surgical aspect of ear, nose, and throat. I'll give you an example. If someone has a hoarseness, persistent hoarseness of voice, they might first see a ENT. ENT will anatomically, medically check their vocal cord. That's and check whether they have any anatomical abnormalities like a vocal nodule or vocal polyp. But we as speech language pathologists, we will give therapy for the individual. So they treat medically and surgically. We treat the voice problem through exercises and giving them care. This is the major difference.
Now, coming to speech and language, what is the difference between a speech problem and a language problem? Can you give us few everyday examples so that our viewers will better understand this?
Sure. Speech is about how we produce certain sounds or words, and language is about how well a person understands and uses word and sentence to communicate. I'll give you an example. A children with speech disorder may substitute a single sound instead of another sound. Sometimes they can omit certain sounds. Sometimes they can produce them incorrectly. Like for example, a child may say tat for cat. This will come under speech disorders. Okay, when it is language disorder, the child may only have limited language which is not appropriate to their age, and they may find difficulty to combine two words and express their need in sentence or in words. So this is the major difference. There are also fluency disorders and voice disorders that will come under speech. Brief examples are these two.
So, coming to speech disorders, are these speech disorders only for kids or even adults have them?
No, a speech and communication disorder can occur at any age. Children may have speech sound disorders, language disorders, fluency disorders, and also developmental communication difficulties. And also, adult can develop communication problems post certain conditions such as stroke, traumatic brain injury, neurological conditions, and other medical conditions. Like if a patient has dementia or Parkinson's, they will also have speech and language difficulties, swallowing difficulties. So, at any age, a speech and language disorder can be acquired. It's not specific to children.
So, but if children have, there are chances that it can be congenital, but in adults, it is mostly acquired after any
Conge-
disorder.
Congenital in the sense if a child has an associative condition like ASD, autism, uh, in condition like that, Down syndrome, then child may have speech and language disorders. And in condition like post-stroke, adult may acquire.
Okay. What are the five early signs of speech or voice issues that people usually ignore?
Okay. Speech and voice, right? Okay. Speech has a fluency as well, so I will include that also. Speech that is consistently difficult for others, like a stranger or a third person, to understand. Um, that are one of the early signs, or that are one of the signs that we have to look into. Parents would understand the child's speech, but when the child speaks to a stranger, that person may find it difficult to understand, and difficulty in finding words or using words, especially if it is new or it is progressing. The child may have difficulty in using words or combining sentence, which is not age adequate. So if a child is 2 years old and the child has to combine words by then, if the child is not doing that, and that's a sign, but we shouldn't have to wait till 2 years. Early sciences are there, like the child may not produce sounds during sounds like ba 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 ka ka ka, that may delay. So that are also few sciences that we have to look into. And with respect to voice, if a person has a persistent hoarseness and there is a noticeable change in their voice, these are the signs they have to look into. And few people, the few people can also have this frequent habit of clearing their throat. If that is there, if they are frequently clearing their throat, this is one of the main sign that you have to look into. And also, a few may feel discomfort while speaking. They may experience vocal fatigue, and these are the signs they shouldn't ignore, basically. Yeah.
So, when
And
they experience these symptoms, they have to meet a speech language pathologist as earliest as possible.
yes, true.
Now, coming to the biggest myth, when we talk, and it happens in most of the household, that overuse of voice can cause voice problems. So, whenever we have a voice problem or even a bad throat or a cold, people usually taunt us saying that because you talk a lot, you get voice problems. So, is that for real that we talk a lot and we get voice problems?
Uh, so, talking itself does not automatically damage your voice, but the problem is often we have to look into how the voice is being used. So, for example, prolonged voice usage or excessive voice usage, when combined with shouting or speaking loudly for a longer duration, or speaking over a background noise, uh, very poor vocal habits like not hydrating properly, and not giving voice rest when you experience a vocal strain or fatigue. These are all the reason for the hoarseness that is caused. But speaking itself doesn't automatically damage your voice. When you do things along with all these combined, will give a hoarseness.
Now, coming to the disorders in particular, what
Mhm.
are articulation disorders?
So articulation disorder is a speech disorder. So, articulation disorders are difficulties in producing certain sounds. So, a person may substitute one sound for another. It's similarly what I explained about speech disorder. It is just similar. It is actually the same. So, a person may omit a sound or produce it incorrectly. Like, for example, a person may say red. Instead of saying red, they can say red. Instead of saying blue, they can say boo. So they omit the letter, the sound, and these are only called articulation disorders. And there's something else that I also want to mention is some sound errors are expected to be there. Errors are should be present during um, the developmental stage. So during early speech development, there are few sound errors that we notice, but that doesn't come under articulation disorders. We don't name it as disorders because children acquire different sound at different ages. So as they grow, they learn how to produce an incorrect sound that they were producing earlier can be corrected as they grow. So the concern has to be they have to be concerned when the error is persistent beyond the expected age or significantly affect the child's clarity. That's when they have to uh, visit an SLP and get assessed about their articulatory.
So, what is the age, ma'am? The age mean limit till when the parent has to wait for a child to develop and come out of these years of articulation.
Okay. So certain sound has to be mastered at certain level. For example, the sound r, r, 2 years old, we can't expect a 2 years old child to produce the sound R. So the sounds R can be mastered at the age of 6 or 7. And for B are the sounds that child will learn at the very early stage. So there are certain sounds that has to be mastered at certain age. Like for an example, I gave two sounds. Likewise, there are age appropriate sounds that has to be acquired.
So, coming to a question, we find lisping very funny when we look into videos or shorts, but is it a really serious problem? And what it needs to be done in case if any person is lisping?
I will first explain what lisping is. So lisping is also a type of speech sound difficulties where a person may substitute her with sir or the. For example, for the word soap, the child may say thope, and for sun, the child may say sun. So th and sun combination. So this is only lisping. We, as you said, we may find it funny, but lisping is not necessary a serious disorder, particularly in very young children. Because as I mentioned earlier, some sound develop gradually. So you have to be worried when the child continues to lisp even after 4 or 5 years. Till 3, it's fine. Or if we correct the child, if the child is able to correct it and follow it in different situation, then we don't have to worry about it. If it still continues beyond the expected age, that's when you have to again visit a SLP.
So, going to the question of voice disorders, can you briefly explain what pathologies exist in voice in relation to voice disorders, voice hoarseness? We find laryngeal nodules and all these things. Can you briefly explain each one of them so that our viewers can understand?
Okay. So voice disorder occurs when, let's say, I will explain. We'll take a teacher for an example. A teacher's profession is to use their voice. They teach using their voice. So teachers, singers, and other professionals who use voice for their job are at risk of voice disorders. Okay. So the voice is produced through vocal cords. We have left vocal cord and right vocal cord. Both the vocal cord will come closer and vibrate like this to produce voice. Okay. So when a person uses excessive uses their voice excessively, um, So we call it as adduction and abduction. So when it vibrates, when it is constantly vibrating without following a proper vocal hygiene, which is not drinking water adequately, and if the teacher yells or shouts in the class to reach the last boy sitting at the end, so usually teachers uses their voice a lot. In that case, the vibration happens consistently for a longer duration, and it will cause anatomical structural modification. A nodule polyps are more like a, what do you say? It's more like uh, a can. What do you say?
Non-cancerous. I think there is a technical glitch. Let us wait for a few seconds for ma'am to return.
Can you hear me, ma'am?
Yes, ma'am. You are audible and you are
It's
still continuing on live.
off. I don't know. I was trying to join back.
Okay. But we are still connected, ma'am. We are still going live.
Okay. Okay. I'm sorry. There was
Yeah,
some.
it's fine.
So to continue what I was telling is, so the professional voice users who uses their voice for prolonged duration without following proper vocal hygiene may develop conditions such as vocal nodule and vocal polyp. Vocal nodule is nothing but a cyst-like formation that you found at, at either or side of the vocal cord. So this might cause hoarseness, and the polyp and nodules will medically treated by ENT. If surgery needed, ENT will do the surgery. After the surgery, after healing, then the person will start with the voice therapy. So the excessive the voice disorder caused due to overusage of voice will be treated by a speech language pathologist through therapy. Yeah, so there are few tips that I would like to tell to maintain vocal hygiene. So, the a person who experience vocal fatigue or hoarseness should always remember to take a break. Conservative voice use is what we recommend, to take break, adequate break, and not to voice stress for too many days. So, if at all they want to talk, they can use it conservatively. They have to drink water with regular breaks. Sips of water is recommended. For 2 hours once, or like 15 minutes once. If the person is going to talk for a longer duration. Every 15 minutes, the person can sip water, and then they have to uh, save themselves from allergies. For example, if teachers use boards, if they use chalk pieces, the dust from that may also cause hoarseness and affect the vocal cord. So the hoarseness are caused due to so many other reasons: acid reflux, allergies, infections, and like the other things that it called vocal nodule, vocal polyps. So keeping hydrating your vocal cords, taking adequate break is very important for the professional voices.
Let me check, ma'am, if I have any further questions.
Okay, ma'am.
I guess questions for today have come to an end. Don't have any other questions. Viewers, if you have any questions, you can post it in the comment section so that ma'am will answer. And yeah, okay. So it means we are going to wrap it up. Thank you so much, ma'am, for being with us, for your precious time and your inputs.
So, ma'am,
Your insights will be valuable to everyone who is seeking support in terms of speech and communication delays. And thank you once again. We hope to have a session with you once again in future so that
thank
we
you so
can,
much. I'm looking
yeah,
forward to that.
yeah. Thank you once again. Thank you.
Thank
With
you so
this,
much, ma'am, for having me today.
yeah, sure.
Thank you
With
for the
this, we are signing off. This is Dr. Arshia here, signing off for Psych Talks 2.0.